This is going to be step 1 in what we call diaphragmatic breathing. So it's going to be learning how to breathe with our diaphragm to create the correct loading of intra-abdominal pressure for correct stabilization for parasympathetic. It's a great way for the nervous system to slow down, perfect for desk workers that get stuck and have a lot of respiratory breathing, which is the high chest breathing. We want to be able to bring that diaphragm down to create a better stabilization and to bring that nervous system down. We are going to start with learning how to do diaphragmatic breathing. So step 1, you're going to have some sort of flat little pillow. I like the balance board underneath you. Your feet are going to be flat. You want your oral diaphragm to be in line with your diaphragm and your pelvic diaphragm. You want to give yourself a little bit of a tilt up on the pelvis. Make sure your back is flat on the floor so you're not in an anterior tilt. If your ribs are splaying out, you have a rib flare, you want to just see if you can kind of, with your muscles, pull that down and hold. From this position, all the breathing is through your nose. So when you inhale, you're going to inhale into your deep intrinsic abdominal core by coming down. So the diaphragm on inhalation is going to meet up with the pelvic floor, creating the pressure. Go ahead and take a breath in and see if you can breathe here. And if it helps, you can put a hand on the side as you can start to feel. When you inhale, you should feel the inhalation into the pelvis. Now, as you get better, you're going to put your hands on the side, and what you want to feel is expansion with the ribs. Try a few breaths into the side. Then from there, you will take your hands in the soft part of your back and see if you can breathe into the back. So the key is to breathe a little bit more into the back and to not put so much pressure on the front that you're almost blowing out the front. You want to think equal and reactive timing through your hands. This is going to be step 2. After we've learned diaphragmatic breathing, this is a great one for back pain. We don't usually move in one plane. Everything has rotation to it. So what we're going to learn to do is to stabilize through the intra-abdominal pressure to lift the leg. Now, I'm going to have her take her hands, place them right here in the lower part of her pelvis, and she is going to take a breath in. And on an exhale, she's going to pull in a little bit together and ever so slightly lift the right leg up just an inch and down. What she should be feeling is activation right here. And she's going to try the other side. Breath in and out and small lift. The key is that when she lifts this leg, she is not wading into the other leg and doesn't have to rotate the pelvis to lift this leg. By stabilizing through here first, she's neurologically teaching her body to be stable before this leg lifts. This is something that's done very, very slowly. And when she's doing this, what she's supposed to be doing is really focusing on pulling in and stabilizing from here. That's teaching her body that she has to be stable before she lifts this leg. One of the cheats is to make sure you're not driving pressure into the other leg to lift the right leg, or that she has to shift her hips to lift this. So I'll show you real quick what that looks like. Let's have you try that, Stacy. Take a breath in and then out, and then see if you can do a little hip shift there and lift. See? That's what we want to avoid, because that rotation is what causes a lot of the back pain. If you are struggling to feel the connection from marches on the floor, seeing if you can stabilize, a better way or another option is to get a block, or you can use a coffee table, or if your couch, you just want to make sure that you have 90 degrees on your hips, and we can do it from here. She's going to take an inhale and exhale. She's going to give herself a little hug and very slowly try and lift her right leg up and down without shifting. This gives you a little bit better feedback when you have your legs up in the 90-degree position. How to know you're doing it wrong. I'm gonna have her just pick up the right leg and see what the left leg does without holding, and see if there's any sort of shift. So go ahead, Stacey, just don't load and lift this leg. and down. So you can see the instant feedback is you're going to want to put pressure into the calf to lift this leg. So if you feel you have to use any part of your other leg to stabilize this, then your core is not stable. So we'll show it one more time. Now she's going to stabilize. Breathe in, exhale, pull in, and hold from here. Gently lift your leg without shifting.